Hi everyone, I'm Jennifer Jackson. I'm a registered nurse and an assistant professor at the Faculty of Nursing at the University of Calgary. And this video talks about validity and reliability in quantitative research, as well as rigor and trustworthiness in qualitative research. So the question we're going to be asking today is, how do you know if a study is any good? So when we think about judgment in terms of other areas, if we saw a house for sale and it said, airy property with panoramic mountain views, lots of green space and parking, perfect for people who want privacy and independence, that sounds pretty good. They've got a lot of boxes ticked there, but it could very much end up being something like this. So how do we spot these kinds of houses in research, and how do we know to look past the words that might be on the page and see overall whether the study is any good? So part of judging whether a study is any good is the role of appraisal. So appraisal is kind of a systematic way of assessing quality in research studies. So the thing not to do is to go through a research study and point out all the limitations and all the things that are so-called wrong. There's no such thing as a research study without limitations. There will always be limitations in research. That's just the nature of how research goes. We never have enough time, we never have enough money, we never have enough help, or some combination of those things. So there have to be compromises along the way. There's also other factors, like COVID-19 has changed how a lot of research studies proceed, but that's because the environment is different, and so the research questions had to be different. So what we want to do is not just pick out every detail and punch holes in a whole study. What we want to do is say, which of these limitations or which of these issues can we accept, and then which of these issues compromise our ability to use this research in practice? Or how do they limit how we apply this work? So it's not so much about did you do this right or did you do this wrong, it's what caveats do we need to have for this research to be used in a clinical setting? Knowing that nursing is practice discipline, in many cases that is our ultimate outcome. Or maybe saying, how are we using this in nursing education or nursing policy? So it's very much, appraisal is very much about what do we need to know in order to be able to use this information safely and effectively. So looking at rigor, which generally applies to how good a study is, or how high quality a study is, that is a key factor in our appraisal. We also need to consider what research paradigm is used, because part of the appraisal is making sure that the paradigm, which we discussed that in a previous class, and there's a previous video on that material. So does the paradigm line up with the methodology, the methods, and the general approaches of the research? If somebody, they can do each individual step correctly and not have any limitations, but if the pieces don't fit together, then you're going to run into issues. And so asking these questions about how do we determine if a study is good is very critically important, because some of the research that we're using can directly affect the outcomes of patients' lives, and we have to be very, very careful. So for example, probably the most distressing modern example of a lack of rigor in a research study is the Wakefield study, where they published that vaccines lead to autism, or there's an association between vaccines and autism. If I remember correctly, that study had only 12 participants, which was should have been a red flag right out of the gate for quantitative work. But ultimately, that study was published in The Lancet, which is one of the highest impact medical journals in the world, and has since spawned the whole anti-vaxxer movement, and arguably thousands of people have died because of a lack of herd immunity leading to more problems. So publishing quality research really matters. This isn't just sort of a box ticking exercise. This is an extension of our efforts to protect patient safety. So as much as nurses who are working clinically are thinking about patient safety, it's nurses who are doing research who are also thinking about patient safety as well. So that's why all of these things are so important. So what we're going to talk about now is how you can look at a research study and recognize different elements that indicate whether you can trust and support that work or whether you should approach it with caution. So depending on the type of research that you do, there are different approaches. Because we can have vastly different kinds of studies, we need to have tailored approaches to how we assess quality in those studies. So for quantitative studies, we're talking about the concepts of validity and reliability. With qualitative studies, it's a little bit murkier, but generally we talk about rigor and trustworthiness. So we're going to go through both, starting with quantitative studies. So when we're looking at quantitative research, the first thing we want to think about is reliability. So are you getting consistent results each time you do something? So an example I've got here on screen is looking at blood pressure. If the person's blood pressure is truly the same, you know, at one time and then again in 5 minutes, are you going to get the same measurement? So is your blood pressure cuff and your blood pressure machine, is it reliable? So reliability is, are you going to get the same result twice? Or are you going to get the same result consistently? So we can look at, can it be reliable for one population, or could it be across cultures, across populations, across time frames? So if we study happiness on January 15th, are we going to get the same results as we would on July 30th? Maybe, maybe not, depending where we are in the world, depending who we're talking to. There can be differences there. So when we say that something is reliable, we mean that it is a consistent measure of whatever thing we are trying to measure. So there's different ways we can look at reliability. So when we kind of subdivide reliability and look at different aspects of it, one element of reliability is stability. So that's saying the result doesn't change over time if nothing changes. So for example, for most adults, if you measure their height, you could say that their height is likely stable for at least age kind of 25 to 50. Their height is going to be stable. It's not going to change. So you can measure it whatever day you want to, but it's still going to be the same. We look at inter-rater reliability. So that's something like saying if I have depression and the next person has depression, and we have equally severe depression, if we take a depression score, are we going to get the same results? And so that is not always something that you want to consider within a research study. That might not be your purpose, to compare kind of how bad something is or how good something is and compare that with how other people are doing. But it is one element of reliability that might be relevant. In contrast, you have intra-relater reliability, where is, rather than compare, say, me to someone else, you compare me to myself. So if I do a questionnaire now, and then I do a questionnaire again in 10 days, and nothing has materially changed with me in that time, is my score going to be the same? So with some study designs, you might not necessarily have results for these, because if you use a questionnaire but you only ask people the questions once, you wouldn't necessarily know about the stability of that questionnaire. So stability, for example, would only apply if you are asking questions, you know, maybe every 3 months for a year or something like that. Consistency is one of the most used and most referred to measures of reliability, because it tends to fit in most quantitative research designs. So essentially, if you're using a questionnaire, the consistency question is, do all of these questions fit together as a group? So if I'm asking you 10 questions about resilience, do all of those 10 questions reliably measure resilience? Now, that is seemingly quite simple, but once you get into the idea that we have constructs of resilience, endurance, perseverance, hardiness, grit, all of those things, sometimes teasing out if you're getting exactly consistent results can be difficult. But the main thing is, with this questionnaire that we're administering, are we getting consistent results with groups of people? So if they score high on one part, are they going to consistently score low on another? So in terms of these sample statistics, the one you're going to see most often is the Cronbach's alpha, and that is a measure of consistency. So somebody is using a questionnaire, that is likely a statistic that they want to include. Now, when you look at the Cronbach's alpha, that statistic alone isn't telling you about the outcomes of the research. So it's not telling you if people scored high or low on their resilience scale. What it tells you is your questionnaire a good tool? So it's a little bit like a test of significance in that it's an important statistical piece, but it doesn't tell you what the outcome was. It tells you about the process for the research. So just be sure if you see Cronbach's alpha, you know that they're measuring consistency, but you also know that doesn't directly tell you about the scores on the questionnaire that has been used. So that was a lot about reliability. Now we're going to switch to the other concept, which is validity. Now, reliability is about, is something consistent each time we measure? What validity asks is, are we actually measuring the thing that we want to measure? So just because something is reliable does not mean it is valid. So for example, you might have a scale to weigh something on, and it could be 3 kilograms off. So it's going to give you a consistent weight each time you step on it, if you step on it 5 or 6 times in a row. But it's going to be 3 kilograms off each time. So validity is saying, are we measuring what we want? Are we getting at that golden nugget? And that is really important because we have all kinds of relationships out there that are reliable, but it does not necessarily mean they are valid. So for example, there are some areas of the world where the death rate is reliably associated with margarine consumption. And so we know that margarine consumption and the death rate, logically, those two things are not directly linked. We could maybe make a roundabout argument about obesity and fats and dietary things, but like even that's a bit of a stretch. So those things are reliably associated, but it doesn't mean that they're a valid measurement of anything other than there's two statistics that kind of go hand in hand. So remember that, because sometimes when you see people with results, they tend to get really excited about, oh, this is associated with this, but have they actually had a valid measurement? That is the main question you want to interrogate there. So there's some different types of validity. So statistical conclusion validity is saying, did you use the right kinds of tests? And did you assume that the relationships that you were testing, are they based on evidence? So for example, you could run statistical tests saying, is intelligence associated with gender? But the fact that you're even discussing that demonstrates that you're not going to have statistical conclusion validity, because the relationship between those variables is not based on research. It's been disproven a million times over that intelligence and gender do not relate. And so you could use statistical tests, but maybe not test the right type of relationship or have the right kind of understanding between your variables. You might not also be able to detect something with a test if you have a small sample size, or that could be a sign that there's other things going wrong, especially if you're implementing an intervention. There's another type of validity in internal validity. So that means something happened that you can't predict. So for example, perhaps someone has improvement in their medical condition, and you could say, well, it's because they took part in this program. Well, maybe they took part in an intervention program and you're measuring their tests before and after, but maybe they also started eating differently, or maybe their condition naturally improved because it's better at different times of the year. So internal validity is really a question of like, did something else happen during that time? So for example, if you were to test happiness right before Christmas among Christians, you might get like a kind of surge of happiness because Christmas tends to be a very happy time. But then 2 weeks later, after we've kind of eaten everything that's in the fridge, then your scores might not be that high. And it's not because someone is subjectively happier or not, it's because things that happened in the environment have influenced your results. So another type is construct validity. So this is the degree to which the instruments you're using are measuring the thing you want to measure. So what can happen is you can have, say, a questionnaire, survey, or a data collection sheet that's used for observation, but you might have participants censor themselves, or maybe the questions aren't aimed in a way that gets at the underlying issue. So for example, I was part of a survey one time for university students where we asked, one of the questions was about the number of sexual partners. And I can almost guarantee you that there was an observational effect because people didn't actually want to tell you how many sexual partners they had. That was a really kind of invasive question, and they didn't feel comfortable answering it in the general health survey. And we shouldn't have asked that, because what we really wanted to get at was, are people using like public health measures like condoms or that type of thing when they are having sex with a new partner? So we should have asked the question like that rather than say, how many sexual partners do you have? So with construct validity, you can just say like, you know what, we didn't actually use the right tools to look at the issue we wanted to look at. The other factor with validity that we've got here is external validity. So this especially could be present across cultures or sometimes with different genders. So for example, maybe if you're doing a test of post-traumatic stress disorder, well, we know that that is generally similar between men and women, but if you're looking at something like shame, we know that that is very different between men and women. And you might be getting different results because of those different contexts, because maybe your sample, the first time you do the study has a very high proportion of women, and the next time the sample has a high proportion of men. So the findings wouldn't be generalizable. Or you could have people who, perhaps in Alberta, if you said, do you like country music, they might have a really high score, but if you go to mainland China, you might find that the score there is much lower. So it's not that that people necessarily have conflicting views, it's just the external validity of that tool doesn't apply to people in other contexts. Another type of validity that's not listed here, but it is worth consideration, is face validity. So this is something that's used if you are using a questionnaire often for the first time and you haven't had a chance to do widespread testing, or maybe before you do a first pilot test, you'll look at the face validity. So face validity is giving your survey or your questionnaire to 5 or 6 experts in the field and say, do you think this will measure the thing I want to measure? Do you think these questions are appropriate? And so you can get an expert opinion on what you think, whether or not that tool will be successful in measuring what you want to measure. So face validity isn't considered as rigorous, but it is a good starting point if you're developing new questionnaires. If somebody was, for example, studying resilience, where we have lots of validated tools for that, and they were using face validity, then I would be nervous. But if you're seeing it in like a pilot, then that is a reasonable way to start saying, how have we been able to measure this concept appropriately? So the other factor that can influence quantitative research is bias. Now, we have to kind of put a fence between quantitative and qualitative for this reason, because quantitative researchers or quantitative studies often operate from the premise that you can manage bias and have neutral results or results that are minimally impacted by bias. Qualitative researchers don't believe you can ever control bias or eliminate it, and that bias is inherent in all the work that you do. So we'll talk about the qualitative viewpoint a little bit more later on. But for bias, for the quantitative side of things, there are different types of bias that can compromise your results or make your study more or less invalid, I guess, or lower quality, depending on what kind of bias is influential. So selection bias refers to inadequate randomization. So selection bias is mostly eliminated now in medical studies because people use like randomization procedures that involve software that can randomize to, you know, such and such percentage of accuracy and that kind of thing. But basically it's that you're making sure that when somebody goes into a research study, whether they get a control or an experimental group is based completely on chance. And that you're not saying, well, you know, I feel really bad for this person, they should really get this medication, so I'm just going to put them into the experimental group and not worry too much about it. That would be an example of selection bias. So performance bias is looking at often when interventions are delivered, are they not delivered the same way? So if you're giving education classes and you have two different presenters, you might have two different approaches. And if one person's really knowledgeable and charismatic and the other person just kind of reads off the slides and that's it, you're going to have probably some performance bias in those groups. Attrition bias, you lose more participants from one group than another. That you would likely see if people are finding your treatment really awful. So if they're maybe in the experimental group, but say they're taking a medication and it's causing a huge number of side effects, and they might just say, you know what, I don't want to be part of the study anymore. So if you find you're losing a lot of participants in that they're withdrawing from the study on the intervention or the experimental side, then you need to stop and say, maybe something's going on here. Because if you pursue that, you're going to end up with attrition bias and your results might be null in the end of the study. So participant bias, this can happen sometimes when you have people who either aren't kind of following the instructions for the study, or they are giving you socially desirable responses, or they're not necessarily disclosing everything. So for example, a colleague did a study where she had people with chronic illness use a small device that was supposed to help their chronic illness. So they brought the device back and then she asked them, okay, how many hours did you use this device? And they were supposed to keep a record. But then what they could actually do was go into the devices themselves and see how many hours the device had been turned on. And they found that there was a lot of participant bias. So some people said, oh yes, I used it every day for 3 hours. And then when they opened the device up, they found it had never been turned on at all. So this doesn't mean that there's anything wrong with your participants, because that person might have felt ashamed that they didn't, you know, they got home and they didn't know how to use the device. Maybe they used it once and it was painful, but, you know, they want to be appeasing to doctors or appeasing to researchers. They don't want to let you down. So it's not to say, we have to be very careful with participant bias, not to put blame on participants, but to be aware that, you know, our experiments and things are all well and good in the lab, but sometimes when they get out in the real world, they don't always implement the way we want them to. So when we think about conceptual bias, this relates a bit to the Wakefield study and saying that the way they conceived of the different ideas and the way the concepts were associated to show supposedly that vaccines related to autism, like there were flaws at that level. And also sometimes you see with studies where they get a conclusion, but they say the conclusion is much bigger than it is. So for example, I know there was a media outlet that once posted that our cell phones are killing us. But when I looked at the study, they actually followed 14 people for 2 weeks and noted that cell phone use before bed was associated with lengthier time to fall asleep. So then what the journalists had done was say, well, if it's taking you longer to fall asleep, you're sleeping less each night, and decreased sleep leads to decreased health. So if you're using your cell phone before bed, it is going to end up killing you sooner. So obviously that's nonsense. There's a lot of leaps that were taken in that line of reasoning. But that is the thing that you see sometimes. So especially when you're hearing scientific studies reported in mainstream media, watch out for things where they're drawing inappropriate conclusions because of that. So very closely linked to conceptual bias is design bias. Was some part of the study not designed optimally? So a colleague of mine did research where she was measuring postpartum pain, and she measured postpartum pain on day 12. And actually, she said by then, almost everyone's pain had resolved, and what she should have been doing was measuring pain on day 3 or day 4 postpartum rather than day 12, because she said by day 12, women had started to heal and they weren't getting the most valid measure. So sometimes depending on how you structure your intervention or what timeline it falls along, there can be issues that way with design bias. And finally, recall bias. That can occur if you're doing something where participants need to reflect on something in the past. So we know from lots of research within law and justice and legal issues, people are not necessarily good at recalling history, like their medical history, for example. And that doesn't mean that they're not smart. It just means that there's a lot of complex things that go into how memories are created and how memories can be influenced. So if you're asking someone like, how bad was your pain 10 days ago? And then how bad is your pain today? You might have an element of recall bias in your study because people aren't always able to report accurately something that's happened to them in the past. So these are a lot of different things to consider. So the main thing when you're looking at a quantitative paper is to try and figure out which measures matter the most in terms of what do I need to be looking for here. So for example, if you are looking at the use of a questionnaire that has been administered one time, you're probably going to see reliability reported in terms of consistency. However, if a questionnaire has been administered several times to the same group of people, you would expect to see different reliability reporting than if you had only administered the questionnaire one time. Same with surveys looking at validity or looking at the validity of a survey. We can talk about validity and having, a valid tool. There are some surveys out there, such as there's a survey for depression, there's one for anxiety, one for resilience, for lots and lots of different things that have been reported valid. So they've been used and tested several times. And we know that they measure the thing we want to measure. If you have a new survey, then we definitely need to see something in the paper about validity and how they established validity in a new survey that they were using. So we also want to see, have they done things to minimize sources of bias or potential threats to validity? So did they say we used software to randomize our participants? Well, that was a way of minimizing the source of bias. Or maybe they, had some measure of double checking results, or they carefully aligned their intervention with a patient's regular appointment times. There can be different things that people can do, and they address different elements of bias or validity. So you need to look at your paper and say, okay, what would I expect if they're using questionnaire for the first time? What would I expect if they're doing an intervention and asking questionnaires before and after? What would I expect if they're doing an intervention and there's a control group and an experimental group? So thinking through each of those things, like what is the study design, will help you see what things should you find reported. And if they have no discussion of reliability or validity or bias, right away, that should send up some red flags. So moving from quantitative research, we're going to shift gears, and now we're going to talk about rigor in qualitative research, which is a different set of language and a different set of approaches. And that also makes sense because our study designs are different. So just like we customize our work in a clinical setting to the needs of the people that we're working with, we also customize how we understand quality in research based on the nature of the research study. So qualitative research, talking about quality, is controversial. There's a wide variety of different frameworks, and there's lots of arguments about how we should not use the terms validity and reliability in qualitative work. Yes, we should. We're talking about the same thing. No, we should use this framework instead. No, we should use that one. There's, like, no matter what perspective you have, there is a published paper about it. So the main thing is to find a framework that is appropriate for that method of the study, or look at the framework that in a paper that an author might describe and say, how does this fit appropriately with the method that was used here? So while there are many different kinds of specific frameworks for evaluating quality in qualitative studies, there are some general principles that kind of transcend those. So one of those principles is looking at qualitative sampling. So have they described some type of theoretical or purposive sampling? So have they talked to people that are experts in the phenomenon, or have they interacted with people that they want to interact with? So for example, if you're doing a study of motherhood, all of your participants need to be a mother. So that sounds kind of trite, but like if you read a study and you say, we did a study on motherhood and we talked to 10 random people from the city of Calgary, I would be nervous because you know that they haven't necessarily spoken to people who know about the thing that they want to ask about. The next one would be constant comparison. So have they compared their findings to their other findings? So for example, if you have a participant that is telling you a different story than everyone else, are you looking at how do those pieces fit together? And does this person truly have a different experience? Or is this just a different element of the same story? That is very closely linked with concurrent data collection and analysis. So with qualitative work, you don't necessarily start with a clear roadmap to the very, very end. You know generally what steps you're going to take, but you have to respond to your participants as you go and respond to the findings and adjust your strategy as you go. So that comes with reflecting on what you've been hearing. So maybe in your study of motherhood, you're finding that work-life balance is a major issue. So in subsequent interviews, you need to start asking more questions about work-life balance. And then maybe in the first 2 or 3 interviews you've analyzed, you need to go back and read them again and see if you missed anything about work-life balance because you weren't looking for it the first time through. So these factors require some adjustment depending on how you're proceeding with your research, but it means that you're really engaged with what's going on and you don't just have a set idea in mind, because that is one of the biggest things that prejudices qualitative research. If you already know what you want to find and you just drive straight towards that, you're going to miss lots of other things along the way. So a mentor of mine said, if something in your data doesn't surprise you, you haven't done good research. So these qualities reflect that kind of intellectual curiosity that comes with it. You also want to think about and look for thick description. So if you have a qualitative paper that only reports 2 participant quotes, and it's 5,000 words long, I would be nervous. You would expect to see lots of participant quotes explaining each of the findings from your study. So reflexivity is another thing that researchers are supposed to put in place. You don't do a very good job of reporting this in the literature, so this is something you'll often find is missing, and that's usually due to the word restrictions that journals put on their published articles. So reflexivity means you're thinking about how you are affecting research and how research is affecting you. So remember that we said qualitative research, there's no such thing as getting rid of your bias. You might want to think about how your bias is impacting on how you're asking questions. So for example, maybe you're doing interviews on some type of injustice. If that injustice is making you really angry and your interviews start becoming angry, it's potentially a threat to the quality of your study. Now that doesn't mean it's wrong to be angry when you're studying injustice. It just means that you have to make sure that you are adjusting your interviews based on your findings, not based on your feelings per se, because research relationships are not therapeutic relationships. This is a research scenario, and researchers have to be very careful of that and manage how they're feeling and recognize how it is influencing the research process. So we don't think you can ever get rid of that influence, but you do need to be aware of it and talk about it. The other thing that is often found in general qualitative research frameworks is an audit trail. So have you kept some kind of records of your decisions? So whether that be daily notes, whether that be a debrief after each interview, whether that be a date log and with times and different things. There's lots of ways it can be done, but have you kept a trail of how you made decisions? Which means that you could go back and refer to those decisions and explain them to someone if they ever said, how did you come to these conclusions? So those were some of the general principles. Now I'm going to take a look at one specific framework. And as I said, there's several in qualitative work, so you have to find the one that's most relevant. But to show you an example, this is kind of the foundational qualitative research quality framework, and it came from GUBA and then later Lincoln and GUBA, so we look at trustworthiness. So when they were talking about trustworthiness, they meant like, can we trust the findings of a study? So the terms that they used were credibility, to look at, have you considered different things that might be happening and taken into account how those patterns might unfold for multiple participants? So if you ask someone, have you been getting a lot of sleep? And they say, no, like I've had a lot of difficulty with sleep. And then you conclude, well, all women who live in Calgary are sleep deprived because of that. It might just be that the night before there was a big hailstorm and it woke everybody up. So have you really looked at those patterns and the complexity of the situations that your participants engage with? And have you considered different angles of the same problem? So transferability reflects whether your findings are interpretive of a given context. So this is not quite the same as generalizing, because the purpose of qualitative research is never to generalize. But you do want to have a degree of transferability in that if you did research with a group of 10 moms and you had, from different ethnic backgrounds and different age groups, if you took another group of 10 moms that were fairly similar in terms of demographics, would you expect to find something that they could recognize in their own experiences? Looking at dependability, do the findings reflect the current reality? So one of the ways to figure that out is look at multiple methods. So that's kind of saying, did you actually catch how someone is feeling about a given situation? Or did you get them on a bad day or a good day? So this happens when you have multiple interviews or you talk to a population of people several times. There's different ways you can say, are these results dependable, or did we just get kind of a flash in the pan? Did we just get a fluke type of finding? And finally, confirmability. I'm getting to practice all my pronunciation today. Confirmability So can the finding be confirmed? So if you gave me your methods section and I went to another population with the same demographics and tried to replicate your study, is there enough detail in your method section that I could implement the study the same way you did? And so would you find similar findings if you went to another group and tried this again? So that doesn't always apply, because sometimes we're talking to people who have, unique experiences. Like if you spoke to someone who lived through the, Fukushima nuclear disaster or the Chernobyl nuclear disaster. Thankfully, there's been very few nuclear disasters on Earth in our kind of recent lifetime and in living memory. So if you interviewed people from that who had that kind of experience, they might not have the same experiences as other groups who had, say, been through disasters, because perhaps elements of being in a nuclear disaster are so unique that you're not going to find that replicated in any other population. But, perhaps the loss of your home is something that is confirmable among people who have survived lots of different kinds of disasters. So it depends on what your research question is as to whether all of these criteria apply. So just some other comments on qualitative research and looking at quality. Some authors, like Sandalowski and Thorne, they argue that the most important thing is to be responsive to your participants and what's happening. So a lot, keeping a fancy list of all the specific techniques is not the most important way to proceed. That it's actually, you need to have the right attitude about your research. And with qualitative research, one of the worst things that can happen is you prejudge your participants' experiences and kind of come up with the answer before you even have an opportunity to create those understandings with them. So that can, or if you get an early idea in your mind and it's so rigid, you said, I talked to 2 people and I understand what's going on here, and you don't let the interviews of other people influence, and you say, you know what, I trust these participants most, that's the answer. If you get really attached to those ideas, you're going to run into trouble, because your study is not going to accurately reflect the experiences or the culture of the group that you're working with. Qualitative analysis is messy. It can be really, really difficult work, like intellectually, emotionally, it is not easy to do. And so sometimes you just get bogged down or you get really stuck on certain ideas, and that can be a threat to the quality of your study. So you need to have that spirit of kind of responsiveness and willing to let go of things, even if you like them. If they don't fit your findings, you have to be willing to walk away. Also, there's no such thing as eliminating bias. Like, I study the things that I study because that's what I'm interested in. So there's an element of bias, like before we even discuss the research question. But for qualitative researchers, we want to talk about those and present that with appropriate caveats, not pretend that we don't have bias or pretend that it has no impact. So just looking at rigor, here's an example from my PhD. Now, some people, as I mentioned, they would say, actually doing this kind of thing isn't really that helpful because it's more about the spirit of your inquiry. But I was a PhD student, and that idea scared me. So I made a nice table to explain to my examiners why I had done what I had done. So this was for an element of the study that used interpretive description. And so you can see over on this side, we've got, oops, apologies. We've got epistemological integrity, representative credibility, analytic logic, and interpretive ability. So that was a framework made by Sally Thorne to complement the method that she developed of interpretive description. So I had an appropriate match between my quality framework and the method I was using. I defined what each one of these things is. I told how different techniques, how different authors have identified different techniques, and then how those techniques can apply to this type of quality principle. And then I gave specific examples of what I did in my thesis. So, you know, generally people say you should have external auditing and peer review. What I did was publish in peer-reviewed journals and work with my supervisors who provided ongoing guidance and support. So this is one example of how you can demonstrate quality in qualitative studies when you don't necessarily have a statistical test that can kind of easily prove that you have reliability or validity. So thinking about what do you check in a qualitative paper, some general principles are, do the participants have experience in the phenomenon? So if you're doing a study on mothers, have they talked to mothers? Have they spent time with the topic? So this one can depend, because you could have 3 or 4 participants in a study, but you interview them 5 times each for an hour each time. I would consider that spending a lot of time with the topic. Or you might have 20 participants and you interview them once, but then you have 20 interviews. So there isn't a set number as to how many you have to have, but you want to know, like, did someone just talk to 3 people for 20 minutes and come up with an idea? Or have they really done justice to this inquiry and spent time kind of getting stuck in and looking at the complex, messy issues? We want to say, was there an analysis plan or framework? Were they guided by a particular methodology? Did they have some way of connecting the different pieces of the study and why they did what they did? If it was completely ad hoc and there was just, you know, they kind of cherry picked what they wanted to do, then you're not going to have a nice cohesive study, and that would make me really nervous. You want to think about, are the findings thoroughly described? And this is where the participant quotes come in. Again, if you open to the findings section and there's only 2 quotes in the whole thing, that is a warning sign. And also you want to say, are the conclusions proportionate to the findings? So if I have studied 20 people, am I going to say that my findings reflect the experiences of these 20 people and perhaps this community more broadly? Or am I going to say that I understand, you know, the lived experience of women the world over, or all people who are, you know, between the ages of 20 and 30? Like, you have to be careful with those things and make sure. We need to be proud of our research, especially in nursing, but we also need to make sure we're not overselling the information that we have created. So we're going to talk, our final piece today is looking at reporting standards, and this is distinct from being about one type of method. This applies to both qualitative and quantitative research. So reporting standards apply more broadly across different kinds of studies. So there's sort of 2 kinds of things that go from different directions. So an appraisal tool looks at whether a study is any good after it has been published. So this is what my class will be doing for your assignment. You have a study and you have an appraisal tool, and you're essentially going through and matching up and saying, have they covered these areas, and what does that indicate about the quality of this study? Reporting standards are guidelines that journals have created to make sure that everything that's published in a journal has shared all the information they need to, so that readers can make a judgment about the quality as they read the publication. So appraisal tools look at after it's published, and reporting standards are more about the publication process and like turning your study into an article. However, both are too late. Both are happening at the dissemination end of a study. So you need to think about quality way back when you start a project and all the way through. So it's not just when you're scrambling to write up a paper, that is when you're considering, oh, did we have an audit trail? Or, oh, did we run a convex alpha to check our reliability? Those types of questions. It's also important to consider when research was published. The rise of evidence-based medicine took place kind of starting about the year 2000. And so if you have research that was published before then, they're probably not going to have as much detail about the methods that allows you to ascertain the validity and reliability or the qualitative rigor of the study. That doesn't necessarily mean the research is bad. I know that oftentimes we encourage you to use articles from the last 5 years. when you're looking to enter clinical practice, that is really important. When you're all in grad studies or in other roles, then sometimes you start to look further back for research. So for example, in my PhD, I included a study from the early 1970s that talked about nurses' work. And the first 10 pages of the study were all about why it was important to study women, because at that time, nurses in this study were all women, and why their thoughts and feelings about their work mattered. So it doesn't mean that that wasn't a good study, but it means that that came from a different era. So this is a conversation I think that is more broadly happening in society, but like, can you apply modern standards to bygone times? And I would just say, approach that with caution. Just because something doesn't meet, 2020 publication guidelines doesn't mean that the study is rubbish. It means that we need to consider the interpretation with a different angle. So this is an example of the Equator network. Equator is the consortium that shares all of the publication guidelines, and they love nothing more than an acronym. So when you're doing your assignment on quality appraisal, I suggest that you find the Equator guideline. As you can see down the side there, there's CONSORT is for randomized control trials. You look at PRISMA for systematic reviews. Find out which method is being reported in your paper, and then find the corresponding reporting guideline. So this isn't going to do your work for you, but it will help you to see what elements you should perhaps have in that paper, and then if they don't have them, you can interrogate that a bit and say, why didn't this go on, and why might these things not be included? And finally, overall, you want to think about that good old-fashioned gut feeling that is rarely wrong. When you're reading research, say, does this make sense? Does this seem reasonable? If you get a sense that, like, you know what, this study is just a little bit off, or like this, I don't think these conclusions make a lot of sense, trust that, because as I said earlier, somebody can tick all the boxes, but it doesn't mean it's good research. So remember, if you don't think it's any good, it's probably not. All right, and that concludes this video. Thank you very much.